So we're getting close to the end of our presentations here. And what we're now going to talk about is healthcare consultants for your decision making. So we've just overloaded you with what, 2.5 hours worth of material. What do I do now? Well, step one, as you're, by spending the time with us, thank you so much, you're getting yourself educated. You're seeing how all this stuff works. Obviously, if you've been in Medicare for a few years, a lot of this is information you've seen previously. But if you're age 63, 64, and either you or your spouse are just getting close to this age, it's a lot of, it can be overwhelming. When you were working in a corporation, in general, you had maybe 2 or 3 options. Your company had an enrollment period in the fall. They gave you 2 or 3 different options, and you picked A, B, or C, and you were done. Obviously, as everything you've seen is a lot more complicated. Medicare Part A, Part B, Medicare Advantage, Medigap, the different types of plans within Medigap, the different types of drug plans, etc. It can be overwhelming. So, and Paul mentioned this to you earlier. Every fall, CMS, which is, we've used that acronym before, but CMS is under U.S. Department of Health and Human Services. It's called the Center for Medicare and Medicaid, CMS. They publish a booklet or a book, and Paul said it's about an inch thick, called Medicare and You, and they update it every fall. So just over the last few days, they came up with a new version. So Medicare and You 2026 is available. And Paul mentioned you can go online right now and just Google it and download the PDF. Or they also have the option that you can have it mailed to you. And it'll end up in your mailbox probably, I'm guessing, by the end of the month or so. So Medicare and You goes through everything we went through, but we've done it kind of in a more abbreviated form as opposed to going through 150 page manual. And it'll go through all the different options that are available to you and the rules that govern them. There really isn't too much that we haven't covered that they cover, and vice versa. But some of them might just be in little footnotes and things. Some of these caveats of guaranteed issue and pre-existing conditions and things like that, they might not really put them in flashing lights the way we have. So now you've got to sort of make some decisions of depending upon not only your health and pre-existing condition and your interest in flexibility and different types of things. So especially when you're younger, quote unquote, and your early 60s, and you're just starting to investigate all this, as John was mentioning, as Paul was mentioning also, some of these decisions will impact you for, quite frankly, the rest of your life. So really doing your homework up front here is really important. And you've taken the definite first step to do that. If you're age 64 or approaching it, then you need to, during this initial enrollment period, you need to make some decisions. So before you make these decisions, you have one initial decision to make. And that decision is, am I a do-it-yourselfer or do I need help? How am I going to make all these decisions? Well, if the 2 basic paths to go is either you're going to do it yourself or you're going to get some advice from an expert. If you do it yourself, then you need to really get very familiar with that Medicare and You book, and then make a decision in terms of whether you're going to go with Medicare, traditional Medicare with a supplement, or going with Medicare Advantage, what's right for you. And you're going to have to do some research because, as I said, this affects you definitely for that, calendar year you're making a decision on, and some of the decisions will affect you, lifelong. The other option is to look, and we've mentioned this a number of times through the presentation, go to experts. But there are a number of different types of experts. Within Southeast Michigan, and that's Livingston County, Macomb, Oakland, and Monroe, and St. Clair, and Washtenaw counties, there is an organization called the Michigan Options Medicare Assistance Program. That's a mouthful. It used to be MMAP. It was Medicare Medicaid Assistance Program. And this is a federally funded organization, and they're all over the country. In Michigan, it's called, or in the Southeast Michigan, definitely, it's called Michigan Ageways Nonprofit Senior Services. They provide, Ageways provides many, many different services for people who are older or the elderly. Unfortunately, we have to categorize ourselves as the elderly these days. So within Ageways, there is this organization called, I'll just call it Michigan Options for a brevity. And that covers what, the 1, 2, 3, 4, 5, 6 different counties. There is a parallel organization that handles the rest of the state, and another many, many parallel organizations that cover other states. So even though we worked for a corporation that was in Southeast Michigan, people obviously are living not only in different states because they were at different, sales offices or plants, but also they might have moved. So if you live in another state now, there are these services available, but they are different. There are different phone numbers and different websites. So we'll show you how you can access that in a second. That is so these trained volunteer consultants, that's bullet point number 1 here. They are volunteers. They are people like us, like you and me, who for philanthropic reasons volunteer to assist people with their healthcare services and insurance needs. And they are unpaid, so they're not compensated at all, but they're doing it out of the goodness of their heart. The second category are insurance agents, and there are many, many out there. These insurance agents, and we have a number of them on this call right now, they are no cost to us, the user of the insurance, but they are private business people, and they get compensated from the insurance companies, similar to a regular insurance broker that you would have for your car insurance or your homeowner's insurance, life insurance, etc. So, but they specialize in healthcare, and in particular healthcare insurance, and in particular for Medicare. So there are 3 consultants that we recommend as NCRO, National Crisis Retirement Organization, and they are Butler Capital Advisors, and the 2 advisors who I think are on this call are Dave Baum and Denise Sikorsky. There's also Double Health USA, and that is represented by a gentleman named Dave Key, and another person, another organization called My Senior Specialists, and her name, who one of the 2 consultants with that organization, is Laura Camacho. And both Laura and Dave Key commented throughout this presentation when we, the NCRO people, didn't have all the facts, and they helped and contribute. So they are experts. They do this for a living, and they really know all that needs to be known about all of these Medicare issues. Another category of insurance agent, and I kind of referred to them previously, is via benefits. Now this is via benefits, not via benefits accounts. And that is an agent that is actually recommended by FCA. So FCA, the corporation, when you retired, probably gave your information to Via Benefits, and you might be getting mailings from Via Benefits because they get your mailing, they get a mailing list from FCA because they are recommended by FCA. The other three, Butler, Double Health, and My Senior Specialist, are the recommendations of NCRO, which is a separate, 50C4 organization that we represent. So in this presentation that will be on the website, so you don't have to write all this stuff down, but I've got a slide that each one of these consultants have provided us. So this one is for this Southeast Michigan with those, 6 different counties. There's their phone number. I'm gonna go really quickly here. If you live in another area of the state or another area of the country, there are the websites that you can go to get this information for the equivalent of this group in other places. Here's the information of Butler Capital. Here's the information about Double Health. Here's information about my senior specialists. And here's the information for Via Benefits. All this information, again, I know I just flashed through those really quickly. All of this will be on the website once we get the webinar videos, but they are currently there from last year, and none of the contact information has changed. So if you want to make, today's Thursday, if you want to start talking to one of the consultants tomorrow, no problem, just go on our website and all that information is there. But the updated slide decks that we've just gone through, and there are slight tweaks that we've done versus last year, will be there in a little bit. Once you've made these decisions and actually enrolled in or decided which insurance provider or how you want to do your Medicare, what you want to do is you want to select the plan. You want to fill out enrollment forms, either online or on paper. They'll start charging you come January of 2026 with your premiums, either directly, you send them a check, or electronically through your bank account. You should then receive also, or as this whole enrollment process goes through, you should be receiving a Medicare card and an insurance card for each one of the different supplements or additional insurance plans you have, and you'll need those obviously when you go to your doctor's office and provide them to the doctor's office. And then you'll probably want to go and set up a user ID and password on each one of their websites, because then you'll be able to actually see, when you're actually rocking and rolling and having doctor's appointments or getting, pharmaceuticals, you'll actually be able to see the claims and the, another TLA, you'll be able to see the EOBs, the explanation of benefits of how much the doctor is charging and how much the insurance is covering and how much your co-pays or co-insurance or deductibles are. So with that, are there any questions either for what I've just gone through on the consultants, or really just any general questions at all?
Just a second, I'm working on it.
Oh, okay. I would mention the availability of anyone to send us an email if they come up with questions later. We're more than happy to answer any questions that come into the insurance committee.
Absolutely. That's why we get paid the big bucks, John.
I got to make myself presenter.
And, just for everyone's information, because there might be some non-FCA people on this call, on this webinar, I kind of joked about that, but no, everyone who, all the presenters today are volunteers. We are all Chrysler retirees and are all doing this because it's just the right thing to do. Okay, does the company prorate the HRA amount if I turn 65 and start Medicare, mid-year and start Medicare? Absolutely. So they not only prorate your HRA, but also they prorate your insurance premiums before you turn 65. So yeah, that age 65 year, you'll have your, if you're still covered by insurance through the corporation, those will go and then stop, and then your HRA will pick up.
Yeah.
Is your or my younger wife still eligible for Stellantis sponsored health plan? Absolutely. If depending upon when you retired and what your retirement benefits were, because Stellantis has been changing those over the years, but if you are older than your spouse and you had Stellantis covered health insurance, then your spouse will still be eligible when you turn 65 until your spouse turns 65. Now, there are some possible limitations on what type of health plan that you can have. They're high deductible healthcare plans and PPOs. So I'd really recommend when you're age 64, or even maybe even asking questions when you're age 63, during the healthcare enrollment time with Stellantis starting in October or so, talk to Benefit Connect and just see, tell them, look in your records and that, you or your spouse are going to be turning age 65 in the next, 12 months. What happens next? And they should be able to go through your particular situation, because there is a ramp down and a ramp up, and they will be able to tell you exactly how it'll affect you. Having trouble signing up for Medicare for a spouse. Social Security site keeps wanting me to sign up for retirement benefits. Very confusing. Have a meeting set up with Social Security office. Okay. Realize that around the country, there are Social Security sites, physical buildings, storefronts. There is no Medicare site, physical buildings in the country. So the Social Security offices also handle a lot of the Medicare enrollment processes. So I don't remember exactly, I went through this a few years ago for my wife and myself. So what I'd recommend is, going to the Social Security site, but going also to the Medicare site, and there should be areas that talk about how you actually enroll. And so you can do some of this stuff virtually, or even now, using AI, Googling it, and you should be able to find information. But, worst come to worst, setting up a meeting at a face-to-face meeting in Social Security offices, definitely you'll get the answers you need.
Mr. Barone,
Yes.
This is Laura Camacho. This is a pretty common issue I've had with a lot of my clients. It's a matter of how you initiated the enrollment to do Part B only versus signing up for the benefits. I can send the proper link to one of you guys to be forwarded on, or they're always welcome to call me, of course, but I can assist with this issue.
Yeah, and I agree, Laura. It's been confusing, and there have been, as you probably read, there's been a lot of cutbacks in the services of Social Security. You've got some things that you never seen happen have happened. Again, and I have been assisting a lot of people with that, as well as probably Laura and others have been doing. So I'd be glad to, not as an agent, because they're not a Social Security representative or government representative, but for people who have that problem, just can't get through, I'd be happy to help them, kind of guide them as a informed citizen, as opposed to any kind of governmental agency, to help with that, because it's unfortunately a lot of strange things are happening.
I would mention, I was at a Social Security office yesterday and I made an appointment online in advance. And so I had a 9 o'clock appointment when they opened with maybe 30 people waiting because they didn't have an appointment. So if you're gonna go to the office, try to go online and get an appointment. Don't just show up and get in the queue.
I would reiterate, I would, totally agree with that. Over the last 9 months or so, a number of Social Security offices have been closing because of what's going on in Washington, D.C. for cost-cutting measures. So that, and especially during COVID, you could only do things, they were doing things virtually. Yeah, I would not go and do, pick a number, just walk into the office and pick a number and wait. Definitely plan ahead. It can, I'm not sure what the wait time is. It might be, can be anywhere from a few days to a few weeks, but definitely, go online and set up the appointment ahead of time.
For this second question, Mr. Brown, I can answer it. The income of the spouse doesn't matter. It's the points. It's how long she's worked. So you need to have worked a total of about 10 full-time years to accumulate the 40 points you need to qualify for Medicare. Them trying to navigate you into enrolling into retirement benefits is simply a matter of misnavigation is all. It's how you started the enrollment process, and it's easily fixed. But no, income has nothing to do with it, unless she's signing up for Medicare under you.
Yeah, I would just add, and I think Laura's absolutely right with everything she said with that. The only thing that might add to that, if even if the spouse is not does not have, and it is not an income, it is those years of service covered basically paid Medicare benefits. So, but if you are eligible for Social Security for Medicare benefits, you might want to find out exactly, and your spouse is not, you might want to find out exactly what the reason is. One of the things that could happen if some reason she did not say qualify for Medicare benefits, and it ends up that's the way it is, you still can, and you still may have the ability to pay for that, pay for the Part A premium. Because sometimes the eligibility and the payment could be different for that, So it's something to check out with that to do it. If you don't meet the 10-year rule, just to check that out a little further to see if there's any other angle that you might be able to get your spouse enrolled.
So let me just ask, let me clarify a little bit. I definitely, under Social Security, there are spousal benefits. If a spouse was only, stayed at home and never actually worked a day in their life, there are spousal benefits under Social Security, but as far as I know, there are no spousal benefits for Medicare. Am I correct? One of the consultants?
There are, so it's not spousal benefits. If somebody has not worked long enough to qualify for their own Medicare free of charge, they can qualify under a spouse, but it's not necessarily the spouse giving them anything. It's just them qualifying. So for example, a homemaker, they're not going to disqualify a homemaker for supporting their spouse while they worked full time. They're simply going to have that homemaker qualify underneath the spouse as the person that's worked for enough credits to have them apply and be able to qualify for free Part A.
Very good.
Yeah, and it's something you need to check out because because you're looking. I mean, you're going to Social Security because they're the front door to get into Medicare. They're the front administrator. But there is a big difference between qualifying, getting spousal benefits because your husband, your husband or your wife worked for so many years and you did not. Then, yeah, if one is qualified, then you have a chance for getting Social Security benefits. But it doesn't always work that way for Medicare benefits. But even if you don't qualify, I mean, it could be something like this. Say if you're not legally present in the U.S. for more than 5 years, for instance, you can still qualify. You can still pay for Medicare Police Part A benefits, but you may not be able to actually have Medicare Part A for free for the 10-year limit. But it's a little bit complicated, but you have to just differentiate between Social Security as a benefit and what Social Security has going that train versus Social Security as a front end to Medicare and what Medicare rules apply.
So bottom line is, if this situation applies to you, set up that appointment with the Social Security office, and they'll walk you through your particular situation.
That's all.
Okay. Well, let's give everyone just a minute or two more. If any lingering questions that are in the back of your mind. We are a little bit ahead of the game, which is very nice. We'll give you back about 30 to 40 minutes of your afternoon.
You did a great job as usual.
Very good. Well, everyone, thank you very much for your time. As we've said a number of times today, all this information, both the videos and the slide decks, will all be on our website, which is ncro.org. That'll happen over the next few weeks. And good luck with your decisions. And we wish you a happy afternoon.
Thank
Thank you very much for providing this valuable service.